Hello everybody, my name is Daniel, and I did my media outreach project on agnosia, specifically giving information about tactile agnosia. I personally don't know anyone with agnosia, however, I became interested with the topic when I learned about it in previous classes. And while learning more about it, it seemed that tactile agnosia did not have as much awareness as other agnosia disorders. I decided to create a website because it allowed me to have creative freedom on what the website would look like. I also felt that a website would be the best option for me to get my point across in spreading awareness for agnosia and other agnosia disorders. And it could also be an easy way for people to have access to the information with it being online. To spread awareness, I had to get more information about agnosia and tactile agnosia. I tried my best to understand what the articles were referring to. It did make it easier that some of the topics we covered in class were mentioned in some of the articles I read. Regardless, it can be difficult to read scientific literature. When putting information down into my website, I try to simplify the information to make it as easy to read as possible. I did my best to provide examples or give videos about the concept. Going off of making the information more easy to read, I also try to make the website as easy to navigate as possible. Going into the content, agnosia is more of an umbrella term that encompasses other agnosia disorders such as tactile agnosia. Agnosia is the inability to recognize stimuli such as people or objects, whereas tactile agnosia is the inability to recognize an object by touch. There are other agnosias that we will get to later in this presentation. Next, I will talk more about causes and treatments. All forms of agnosia are to be caused by brain damage or diseases, and depending which area of the brain is damaged results in a particular agnosia. Damage to the parietal cortex results in tactile agnosia. Treatment is usually getting surgery to repair the damaged area or going to therapy to be rehabilitated. Agnosia affects a person's life by having the person rely on their other senses to identify an object. In a video I found, a person was getting ready but had a hard time identifying the objects in their restroom. At one point, they were having trouble finding the toothbrush and accidentally almost used a comb. But by smelling, looking, and feeling the object, the person was able to locate where the toothbrush was. Using other senses is helpful in identifying objects. However, specific agnosias are related to a specific sense, such as visual agnosia would cause problems with using sight, auditory agnosia would cause problems with using hearing, and tactile agnosia would cause problems with using touch. I decided to focus more on tactile agnosia as more people are not aware of it. With tactile agnosia, a person has a hard time using touch as a method of identifying objects. The reason being is because the parietal cortex is damaged, which causes damage to the where pathway, and there's also damage to the what pathway, which leads to the temporal lobe. With these pathways being affected, it seems that tactile agnosia arises from high-level processes being affected. There have been studies that show that when the what pathway in the inferior temporal lobe is affected, it can induce tactile agnosia. Even more interesting to note is that if the brain area is impacted, not only does tactile agnosia occur, but so does the impairment of semantic memory. Research claims the reason both would be affected if the inferior temporal lobe was damaged is because both deal with recognition. More interesting to note is that damage to the where pathway or posterior parietal cortex can lead to the understanding of other disorders, such as tactile apraxia, which is having repetitive movement. Tactile apraxia is due to damage of the anterior intraparietal area. Damage to these areas show a pattern on how impaired brain areas can affect tactile perception or tactile movement. To recover from tactile agnosia, surgery could be used to repair or remove the damaged area, or going to an occupational therapist can also help. Occupational therapists will be able to help patients compensate for the deficit. An occupational therapist also identifies if an individual has tactile agnosia by asking the patients to identify an object with their hands while they have their eyes closed. In the umbrella term agnosia, it can be divided up into three main categories. There are visual agnosia, auditory agnosia, and the one I talked about is tactile agnosia. Visual agnosia is the awareness has the most awareness of it and is defined by the inability to visually recognize an object, while auditory agnosia is inability to differentiate these sounds, not being able to give meaning to it. Between those three categories, they can be subdivided into even more categories. Two specific types of agnosias are prosopagnosia and topographic agnosia. Prosopagnosia is the inability to recognize faces, and topographic agnosia is the inability to recognize spatial layouts of buildings, each being caused due to specific brain areas being affected by severe trauma or by diseases. An organization I linked to my website was NORD, the National Organization for Rare Disorders. They focus on rare disorders including visual agnosia, however they do not mention other agnosias. This website provides extensive information about identification, treatment, and cure of rare disorders. They continue to release new information about rare disorders as they aim to advocate for the improved lives of individuals with rare disorders. One last thing I want to mention is how to care for someone with agnosia. To do that, you can lay out what they need, prompt them what the item they need to find next, help the individual form a routine. If the individual is about to make a mistake, tell them to check again, and do not take over the task for the individual, just provide support. One last thing is be patient with the individual with agnosia, as they may take longer to complete tasks. I had things I liked and didn't like about making a website. I liked that I had creative freedom, was able to add videos, was able to choose what pictures to add. I also liked that I was able to publish this on the internet for everyone to access. What I did not like about the website is that I did not have a physical copy of the information, and it took a long time to make, and I realized the format would be different on a phone. What I could have done differently for the project was make a physical copy of the information. I would have designed the website to be more phone friendly, since I realized that looking at the website on a phone changes some of the formatting compared to viewing it on a computer. I'd also like to go into more depth with other agnosias, such as visual and auditory agnosia, but did not want to overwhelm people with the information. Additionally, I felt that if I picked a different medium, I would have chosen to do a brochure, just so people could have better access to information and would be able to reach more people, such as people in schools, hospitals, workplaces, and other locations that have a high number of people. It would also let me use more concise wording. However, I would not be able to add any videos to my brochure, as I did with the website. Overall, I had a great time in creating this project. I got to learn more about agnosia, especially tactile agnosia, and how it can affect a person's daily life. I'm glad to provide resources for those who are affected or know of people who are affected. I hope you all enjoyed my outreach project. Thank you for listening. Also, in my next slide, I'll be this is where I have all my works cited. Thank you.